Hi, welcome to the first in what's going to be a series of presentations using PowerPoint with some recorded information to take a look at some ways that you can be successful in the respiratory therapy profession in the long run. So we're going to take a look. It's titled How to Succeed in Respiratory Care by Trying. That's what we're going to take a bit of a look at as we take a view of where we're headed. So there are several ways that success in the program and in the profession can be defined. One measure of success would be getting the passing grade in all of the courses. In the respiratory therapy classes, that's a grade of C or better. Another measure of success, or the way that success could be defined, is to complete all of the classes in the program. Ultimately, people would hope then to graduate from the program, which would then give them ability to take the examination to obtain employment, first a license and then employment in the respiratory therapy profession. And that exam currently is called the Certified Respiratory Therapist exam. That will be changing in January of 2015 to a new name of the exam and a little bit different setup called the Therapist Multiple Choice Examination. Others might define success as obtaining a job and then being able to keep that job. Another might be passing the examinations to obtain the registered respiratory therapist credential, which is considered the credential of excellence for the respiratory therapy profession. Excuse me. Me personally, I kind of think of success in this profession as advancing and excelling in the profession of respiratory care, and we'll talk a bit more about what that really involves. But as we take a look at this, we're really kind of looking at what are your responsibilities as a student versus our responsibilities as instructors in the classes that you're going to take in the program. And each of us has different and unique roles in terms of what our jobs are, what it is that we're about. A couple things are really important. There is no way that Larry or I or any other instructor that you have here at the college or anywhere, we cannot make you learn. It is up to you to decide to learn, to put forth the effort, and to learn the things you need to learn. You, on the other hand, do have the ability to make us as teachers teach. What I see our role as your instructors in this program, is we're about creating the situation or environment in which you can learn all of the things that you need to learn to become a professional respiratory therapist. So we have responsibility to manage the environment in which you learn. We have to be prepared to convey some information to you that you need. A lot of that learning, though, occurs through work and effort on your part. We are required to be organized so that you can make sense of the information, so that things follow and flow in a planned out method to help you learn the information, the skills, the abilities that you're going to need to have. We have a responsibility to sequence things in such a way that it promotes your learning. You'll see as we go through the program that in a semester you may learn a lot of skills or specific things, and then you will utilize and practice those skills taking care of patients in a succeeding or in the next semester. We do have a responsibility to regularly check on how you're learning and what you are learning, making sure that you are gathering the information, developing the skills, and that you're progressing in a proper function, a proper way of moving forward. We do need to hold you accountable for learning. It is our responsibility to make sure that certain things have been accomplished. When you take examinations to get credentials and a license down the road, that samples a piece of what you need to learn. It only really samples the knowledge or the cognitive aspect, and we'll talk more in a later program about the different domains of learning. But basically all of the assessment of your learning in the psychomotor or skills area and the affective or attitudes area, all of that's really a responsibility of the educational program, and that's what we're about here. We also have a responsibility to get feedback on how well we're doing, and you will have multiple opportunities through the program to provide input into how you perceive the teaching learning process to be working. We do have a responsibility to engage you as a student in the learning process, to create again the environment and the activities that will allow you to become engaged and active in your learning. We have a responsibility to, as I said, evaluate how we're doing, seek your feedback for us to evaluate how we do, and then to modify things that we're doing within the program to have it continue to be a very useful and progressive program. And we have a responsibility to ask you questions from time to time, again, to evaluate whether what we think is occurring with your learning is actually occurring. So a lot of that will occur in class, in clinical settings, in the laboratory, not necessarily formal testing type of questions, but other just asking verbal questions, evaluating where things are. You have a responsibility for the work, most of the work that goes into your learning. To do that, you need to come to class prepared to learn each day. That means you need to be rested. It's very difficult to work a 12-hour shift leading up to the time that you come to class in the morning and to be rested enough to be ready to learn. You need to complete the reading that has been assigned, because what we're going to be doing in class is taking the base knowledge that you've obtained from your reading and building upon that, teaching you and working with how that information is applied and how that's really used. You need to have completed the objectives. We don't currently do this, but there are some classes and programs where someone is not allowed to attend class if they haven't completed those objectives. You will be completing objectives. We'll talk, or we probably, by the time you're seeing this, have talked about that in class. You'll be completing those and submitting them within the Blackboard environment for the course delivery. You need to be actively engaged in class. That involves several things. It means putting aside all of those things that can distract you from being actively engaged in class. There's a real temptation, and many people these days are really tied to their cell phones and their other electronic devices. And there's a real temptation from time to time, if that phone vibrates or in some way indicates that you've received a text or an email or something has been posted to a social media site, there's almost a power it has over us to demand our attention. But we need to put those things aside so that they're not distracting us from what we're supposed to be doing. We also have situations where other students may be the distracting piece. Somebody talking to you, somebody else doing something that's distracting. You will also have a number of assignments that you're going to complete, usually to enable you to practice with and to build upon the basic information that you're learning. As I've said a couple times already, you are the one responsible for your learning. I cannot force you to learn anything. You need to be the one who does that. Another thing is to asking questions. There are going to be times where some of the information you get from the reading may be confusing, may be hard to figure out what it's all about. Ask questions. I know it's not comfortable at first, and it's like, well, I don't want to look like I'm dumb. Another thing I will tell you is if you ever ask a question in class and precede it with, this may be a dumb question, I will comment on that, because there is no such thing as a dumb question. If you don't understand something, or if you want to understand it better, ask the question. You can pretty much be sure that if you have the question, so do probably half of the people in the room. So please, when something is unclear or when we say something that is not anything that you understand, please ask questions. As you are able to share some of your experiences and some of ideas and things that you've learned in whatever setting, those are tremendous in terms of contributing to the engagement and the activity of learning. The other thing is we're going over information, try not to get so hung up on getting it written down, getting it noted or whatever. Yes, it's important to take some notes. It's important to put some things down because some of us learn by writing these things down. But engage your brain. Think about what's going on. Think about what's being said. Try to relate it to what you already know. And you're going to have an opportunity to complete an inventory of your learning style and to be aware of your learning style as you progress forward. And that will conclude this first presentation, and you'll be able to go on to the succeeding presentation.